There are many diet fads out there today. South Beach, Plan Z, keto, paleo are some of the most common that we hear about. Are these eating habits really beneficial when we're trying to be healthy? What is the definition of healthy? Is it all about looking good, or is it about keeping your heart and other organs healthy, or both? Although there are many situations and genetic aspects in people that affect the answers to these questions, today we are going to look at overall heart health and the diet implications that are the most beneficial in keeping this beating organ of ours working properly for as long as possible. Science has provided many studies into this area, and one of the most common dietary approaches to overall heart health is the low-fat, low-salt diet. So why low-fat, low-salt? First, we need to look at why excess fat and salt in the bloodstream are not optimal. We also need to make clear that today we are not talking about athletes or incredibly active people who exercise intensely and frequently. An athlete's requirements are going to be much different than the average Joe. We are talking about ordinary people who may or may not work out on a regular basis, but who are looking to maximize their blood pressure and decrease their likelihood of having a major cardiac event. In America, one of the first places a person may find themselves looking for the best diet information about heart health is from the American Heart Association. To paraphrase the American Heart Association guidelines on dietary recommendations, a person should look for lean cuts of meat, eat at least 2 servings of fish oil, omega-3 fatty acids per week, limit saturated fat intake to no more than 5 to 6% of total calories, and try to get your sodium intake to no more than 2,400 milligrams per day, and 1,500 milligrams if you want to optimize your results. The staff over at Mayo Clinic also recommends approximately the same thing as the AHA, and also includes eating more vegetables, limiting overall caloric intake, and they also give some general dietary guidelines for choices, providing choices for readers to select from, which is nice. Without going into an in-depth lecture on fat metabolism and storage, or the anatomy and physiology of the heart, the idea is that excess circulating fat gets deposited into your arteries. Those 3 main arteries that we're mostly concerned with are the left anterior descending, which goes right down the front of the heart, the right main artery, which supplies kind of the back side of the heart, and the circumflex, which goes around the other side and supplies the side and back of the heart. These main arteries and their branches supply oxygen-rich blood to the cardiac tissues. When high levels of fat or cholesterol are present in the bloodstream, they tend to get deposited in and along those arterial walls. Over time, these plaques grow and eventually occlude blood flow in the coronary arteries. When this happens, heart tissue becomes starved of oxygen and eventually dies if it's not promptly treated. Clinically, this situation is just one flavor of a myocardial infarction or a heart attack. You can think of this as sort of like pouring bacon grease down your sink. You won't notice anything is wrong until you've got a big mess on your hands. In an article presented by the Journal of the American College of Cardiology, they point out that in overweight or obese adults with or without elevated cardiovascular risk, there is a dose-response relationship between the amount of weight loss achieved by lifestyle intervention and the improvement in their lipid profile. What this means is that if you are obese, as most Americans are, just by losing some weight, you're changing your lipid profile, which lowers your cardiovascular risk. This corresponds with the AHA guidelines of eating healthier, more veggies, less fat, less salt, more exercise. However, before you throw away your bacon, there's some good news and some bad news. Dr. Neeson of the Cleveland Clinic states most circulating cholesterol is produced by the liver. So dietary cholesterol accounts for only about 15 to 20% of blood cholesterol, and changing the diet typically only has a modest effect on serum cholesterol levels. So what are we to do with this conflicting information? If our liver is the main problem, then why are we paying attention to what we're eating at all? The answer is because even if our diet only accounts for the 15 or 20% of cholesterol circulating in our blood, over the course of a lifetime, with a focus on reducing the modifiable risk factor of diet, we may be able to reduce our overall risk of a major cardiovascular event like a heart attack or a stroke. So, we also need to keep an eye on how much salt or sodium you're ingesting. Again, without going into a lecture about osmosis and the effects of hyper and hypomagnesemia and hyponatremia on organs, we can simply say that salt makes you retain water, which increases your blood pressure, which is not good for your heart or your kidneys. Patrick Scarrett of Harvard Health references a journal article and a study in the Journal of the American Medical Association that seems to present a contradictory finding that says low salt intake is actually harmful to your body and may result in an increased risk of cardiovascular events. However, he quickly points out that the flaws of the study and highlights the need for more comprehensive research, as well as recommendations to exercise more, and again, watch what you're eating overall. The Institute of Health also points to some research in heart failure patients that seems to conclude that a less restrictive sodium diet and more focus on the impact of micronutrients may be a better alternative to the very low sodium recommendations made in the past. So what's the takeaway from all this? Essentially, until further research proves otherwise, we should adopt healthier changes in our diets, which includes lower fat, lower salt intake. Lowering fats and salts in our diets are obviously only one piece of the overall puzzle to health. Genetic makeup, exercise habits, lifestyle choices are also big pieces to this puzzle that are equally important to our health as our eating habits are. In my work, I've encountered adults of almost all ages with critical ailments who live far cleaner lifestyles than their older, more unhealthy counterparts. This speaks to the importance of the need for further research to pinpoint areas of genetic expression and external impacts that combine to cause cardiovascular disease. Until that research is completed and conclusive, our best approach for the time being is to follow the generally well-accepted guidelines of the heart experts to lower our fat and our salt intake. Along with the other recommendations of increasing exercise frequency and duration, choosing less sugary foods, reduction in obesity, and just improving your lifestyle choices, we can help to modify our long-term risk factors for a major cardiac event. If what you're looking for is a diet to help you get skinny in the short term, low fat, low salt will definitely aid you in that goal, as long as the reduction in overall caloric intake is sufficient. So don't throw away your bacon, maybe just don't eat it every day.